Next case, I call this the importance of pathology review. In my fellowship with Larry Lipschultz, we did a lot of time with Dr. Wheeler looking at testicular biopsy slides. I don't do many testicular biopsies anymore. Actually, it's very uncommon for me to do that. We used to do it. So we got comfortable with the pathology. I don't know how many people look at pathology. I had a 35-year-old male who came to see me with history of unilateral undescended testis and orchiectomy for that testicle. And he presented with severe oligospermia, cryptozoospermia. He had a FSH that was somewhat elevated at 13.5, and normal testosterone, the triple genetics, Y micro, karyotype, and CF were all normal. He had been seen by a urologist prior to see me, who performed a testicular biopsy, which was read as germ cell aplasia with very rare germ cells and spermatids. So with this reading, the interpretation or how the pathologist has phrased it is a little bit curious. How does somebody have rare germ cells, but yet they also have spermatids? So I said, let me see those slides. I took a look at it, and although this is not from him, this is basically what I saw. Lots of fried eggs looking type cells filling really most of the tubules. I had the pathology re-reviewed by a pathologist that I know, and we agreed. It was extensive intratubular germ cell neoplasia. There was no maturation arrest on the biopsy. Just a very significant minority of tubules had sperm production. So how did we manage this patient? Well, he banked sperm. He had very few sperm in the ejaculate, but he just gave multiple ejaculates and banked it, and went on to IVF with his wife. I'm not sure how you would have managed this patient. The patient went on for a second opinion and had orchiectomy. I probably would have done or recommend, I should say I did recommend radiation at the time, but he did go on for orchiectomy, and pathology at the orchiectomy actually did reveal a small focus of seminoma that was the remainder of the testicle. All right. So I thought this management was changed, or my management was changed in this patient by pathology review. If I had never reviewed it, who knows what would have happened.